And, we talk a lot about things like technology at this conference and how we're setting up data for things like future use. This work is so exciting. I mean, the thought of maybe potential vaccine and preventative measures for cancer is exciting. What is the kind of the process, or what are you thinking about how data is being handled in light of emerging technologies, things like artificial intelligence and machine learning? Is that something that's on your radar right now?
Yeah, so the question is, what are these T cells recognizing if we want to develop a vaccine? Obviously, that's the million-dollar question. And we hope that newer technologies will help us understand that, because we're collecting the TCRs now, and trying to understand what the T cell receptor is recognizing, of course, is very, very difficult. And hopefully these new technologies can help us with that.
Mhm. So tell me a little bit about what the next steps in your research would be. Are you looking at ways to pharmacologically or immunologically recreate this? What's your vision for the next kind of phase of your work?
Yeah, so we've spoken about vaccines, so trying to understand what the T cells are seeing. I think getting a better understanding of how reproductive history affects response to immunotherapies for the treatment of women with triple negative breast cancer. It is plausible from our data that we may be treating women who've not had children very differently from women who've had children, for example. Um, just trying to understand, for example, how um, therapies inhibit lymphocyte tracking, or how circulating of your white blood cells, because we can tell from our data it's really important that the T cells come into the breast as well as the ones within the breast to act against breast cancer, and you can imagine that would help for the rest of the body as well. And also, we can think about different screening methods for women who've not had children, for example. They might need more intensive screening or a different type of screening. We heard about these new blood-based early detection tests,
Mm.
so different screening methods as well. And obviously, there's the whole issue about supporting breastfeeding in our society. So, workplace policy, cultural supports, lactation supports, and just support for women, because now we know that it's actually really important for not only the baby, but for the mother.
Mm.